tonight with a surge of coronavirus cases across Ohio, and now more than half of the people in the state live in an area with an elevated risk for COVID-19. 65% of Ohio's population now lives in a level 3 or red county. That means there are 100 cases per 100,000 residents in the past 2 weeks. Locally, Mahoning County still remains in that category. In the last 24 hours, there have been 2,178 new COVID-19 cases reported. During his coronavirus briefing today, Ohio Governor Mike DeWine added to look at the news of recent red counties like a weather forecast. It's something we can't change, but we can prepare for.
We can't change the weather, but we can change the outcome. And so these are reflection of what we see today, but also a reflection of early warning signs. But we can change the ultimate outcome down the road by what we do today.
DeWine said the COVID-19 pandemic may not come to an end until next summer. For a while there, it looked like Ohio might be turning a corner with some low numbers and long-term care facilities getting cases under control. So what happened? Dr. D. Banks, a local expert in infectious disease, joins us now to help put some perspective on that. Dr. Banks, 2 straight days of record numbers of cases. What are we doing wrong?
Well, I think it's a multifactorial situation. We started to see increments of individuals coming in the hospital about the end of August, and we kind of felt that things were starting to go in the wrong direction. I think, we had a lull at the end of July. We kind of caught our breath, but I think basically we've let our guard down. I think that schools have gone back into session, and every day, if you look on the news, there's another outbreak of COVID-19 in our colleges and universities where students are having to quarantine. And as you mentioned, our nursing home, we're starting to see an influx of patients from our nursing homes. I think the science is clear. We are not doing those things that we were told early on that we needed to do to prevent the spread of this virus. Every now and then you hear about these super spreaders. I'm still amazed at the number of individuals that are having weddings with large gatherings of individuals, and that wasn't happening 3 or 4 months ago, or funerals. So I think people sort of got a feeling of complacency, quarantine fatigue, which we all have, but the science is clear. We're not over this virus, and I think it's going to get much worse before it gets better.
So in 20, 30 seconds, how do we correct this moving forward?
I think it's simple. We have to continue to wear our masks, and nobody wants to go back to shelter in place and shutting things down, but I think we can do it on our own. Don't go to large gatherings, social distance, and wash your hands. Do your own shelter in place, your own staying at home, and I think we can get a hold on this again.
All right, Dr. D. Banks, thank you so much for the insight as always.
Thank you for having me.
We'll stay up to date with the latest coronavirus news from cases, testing locations, and vaccine trials with WFMJ.com and the 21 News mobile app.